Did you know cervical mucus is a great way to predict ovulation? Whether you're trying to conceive or just simply curious about your menstrual cycle, cervical mucus can tell you so much, and it's so important to watch. I'm Nurse Heather, medical advisor with Premom, and today we're going to chat about what is cervical mucus, its role in ovulation, and how it changes throughout your menstrual cycle to tell you whether you're fertile or not. So first things first, what is cervical mucus? It is a natural substance secreted by your cervix, the lower part of your uterus that connects to the vagina. This changes its consistency and quality throughout your menstrual cycle due to many hormonal fluctuations such as estrogen and progesterone. It serves many functions as well. It provides lubrication during intercourse. It helps nourish, protect, and transport those traveling sperm to the egg, and it decreases the amount of bacteria that's able to enter the uterus. Now, let's divide your menstrual cycle into 4 different phases. So we've got our menstrual phase, follicular phase, ovulatory phase, and luteal phase. So all 4 of these really big words for these phrases each bring something different to the table in terms of quantity and quality of cervical mucus. And it can tell you pretty much how fertile you are. Is that cervical mucus going to be friendly to sperm? So let's start with the first one, the menstrual phase. You're going to experience next to no cervical mucus. This is known as our dry phase. Once your period ends, we're entering that second phase, the follicular phase. This is when cervical mucus starts to get a little bit more abundant. You're going to experience maybe like a thick, sticky, opaque cervical mucus. And once you start to enter that fertile window, that ovulatory phase, your cervical mucus is really going to change. It's going to become much more thin, clear, and really stretchy. This is a perfect environment for sperm. It's easy for them to swim through. It's easy for them to survive in. They can survive for up to 5 days in this optimal fertile cervical mucus. So when you time intercourse in your fertile window, this beautiful cervical mucus helps sperm survive to get to the egg when it's released. So what you're looking for is something that looks like raw egg whites. It really does look like a raw egg white. So if you stretch that cervical mucus in between your fingers, it's going to be really stretchy, thin, and watery. This is perfect. Once that ovulatory phase closes and ovulation has happened, then we enter our luteal phase. This is typically your most non-fertile time. So no chances of getting pregnant in your luteal phase. Ovulation has already happened. So cervical mucus is going to start to dry up a bit more due to the hormone progesterone taking over for this part of your cycle. As you can see, tracking your cervical mucus throughout your cycle can be really important to help you identify those most fertile days if you are trying to get pregnant. And even if you're not, it can also help you identify underlying hormonal imbalances. Remember that estrogen we talked about a little bit earlier and how it peaks during the time of ovulation? Well, if you're not seeing any cervical mucus or you're concerned about the quality of your cervical mucus, that can help you start a conversation with your doctor to maybe have a hormone panel done and see if there's any underlying hormonal imbalances going on. It's really important to stay on top of your fertility health because ovulation is a sign of health, so very important. The free Premom app can help you track your cervical mucus along with your cycle and help you figure out if what you're seeing is appropriate with where you are in your cycle and what it means for your fertility. If you liked learning about your fertility, feel free to like this video, leave your thoughts in the comments, and don't forget to subscribe to our channel so you never miss an opportunity to learn about your body and your fertility.